Most people don't realize that vitamin B12 is one of the most important nutrients their body needs to stay healthy. We often pay close attention to vitamins and minerals like vitamin D, magnesium, or potassium, but rarely give B12 the same attention. What many don't know is that a deficiency in vitamin B12 can trigger serious, and sometimes irreversible, problems throughout the body. And here's the real issue. A lot of people who experience symptoms of low B12 often mistake them for magnesium or potassium deficiency, focusing only on those and completely neglecting their B12 levels until it's far too late. That's why in this video, we're going to talk about 9 early and sometimes weird signs of low vitamin B12 that you must never ignore and should address as soon as possible. And if you're wondering, is B12 deficiency even common? The answer is a big yes. It's especially common in people over the age of 60, and studies show it can dramatically increase the risk of high blood pressure, stroke, and even dementia if left untreated. So before we dive in, please take a second to hit that like button and subscribe to the channel. It really helps this video reach more people who need to hear this, and make sure to watch till the end, because we'll also share the best and safest way to get out of B12 deficiency naturally. Alright, let's get started. 1. Brain fog and poor memory. While brain fog or poor memory could be caused by high blood sugar or other nutrient deficiencies like magnesium, vitamin D, or even omega-3 fatty acids, a vitamin B12 deficiency is one of the most commonly overlooked causes. Vitamin B12 plays a key role in producing and maintaining the protective covering around your nerves and in supporting healthy brain cells. When your levels drop, your brain literally slows down, leading to confusion, forgetfulness, difficulty concentrating, and poor mental clarity. Some people describe it as feeling like their mind is wrapped in a thick fog. And the scary part? If B12 deficiency continues for too long, it can cause permanent nerve and brain damage, increasing the risk of cognitive decline, dementia, and even Alzheimer's disease. So if you've been feeling unusually forgetful or mentally sluggish, it might not just be stress, and it could be your body's way of saying, I need more B12. 2. Shortness of breath or dizziness. While shortness of breath or dizziness might make most people think of lung or heart problems, a vitamin B12 deficiency can also be a powerful hidden cause, and it's one that doctors often overlook. Here's what happens. Vitamin B12 is essential for producing healthy red blood cells. Without enough of it, your body starts creating red blood cells that are larger and more fragile than normal, a condition called megaloblastic anemia. These cells struggle to carry oxygen efficiently, which means your organs and tissues receive far less oxygen than they need. When this happens, your body tries to compensate by breathing faster and increasing your heart rate, which leads to that shortness of breath and lightheaded feeling, even when you haven't done much physical activity. Studies published in medical journals such as StatPearls and the New England Journal of Medicine confirm that people with B12 deficiency anemia often experience dyspnea, dizziness, and palpitations as early warning signs of oxygen deprivation. This happens because the blood simply can't deliver enough oxygen to meet the body's demands. If you've noticed yourself getting winded more easily or feeling lightheaded when standing, it's important not to brush it off as aging or stress. A simple blood test can reveal a lot. Doctors often start with a complete blood count, CBC, to check for large red blood cells and low hemoglobin. But here's something crucial. Even if your B12 levels appear normal on paper, you could still be deficient. In that case, a methylmalonic acid, MMA, or homocysteine test is more accurate and can detect early stages of deficiency that regular tests miss. 3. Mood swings, anxiety, or depression. Here's the thing. Many people who think they have an anxiety disorder or depression are really just deficient in certain nutrients that regulate mood and brain chemistry, and one of the most overlooked among them is vitamin B12. You see, vitamin B12 plays a vital role in the production of key brain chemicals like serotonin and dopamine, the same neurotransmitters that control your mood, motivation, and emotional balance. When your B12 levels drop too low, the production of these feel-good hormones slows down, and as a result you may start to feel unusually anxious, irritable, or even depressed, for reasons that seem hard to explain. Research published in the Journal of Psychopharmacology and other psychiatric studies has shown that low levels of vitamin B12 are linked with a higher risk of mood disorders, including major depression and chronic anxiety. One study even found that individuals with B12 deficiency we're more than twice as likely to experience depression compared to those with healthy B12 levels. But there's another layer to this. A lack of B12 can also cause fatigue and sleep disturbances, which further worsen mood issues. Imagine trying to feel happy or calm when your brain is literally running on low energy. That's what happens when B12 is missing. It's no surprise that many people who are diagnosed with depression start feeling significantly better once they begin B12 supplementation or injections under medical supervision. Mouth ulcers and a sore tongue. At first, when you have mouth ulcers or a sore tongue, you might think it's from eating something spicy, brushing too hard, or zinc deficiency. But what most people don't realize is that these painful spots can actually be one of the earliest signs of a vitamin B12 deficiency. Here's why. Vitamin B12 plays a vital role in the production of red blood cells and the repair of rapidly dividing tissues, and your mouth happens to contain some of the fastest regenerating cells in the entire body. When B12 levels drop, the body struggles to make enough healthy red blood cells, leading to less oxygen reaching the tissues inside your mouth. This oxygen shortage, combined with impaired cell regeneration, can cause the lining of the mouth and tongue to become inflamed, sore, and prone to ulcers. You might notice that your tongue looks unusually smooth, swollen, or red, a condition called glossitis. It can make eating, drinking, or even talking uncomfortable. Some people also describe a burning sensation on their tongue, as though they've scalded it with hot tea. In more severe cases, the tongue can lose its tiny taste buds, altering how food tastes. Vision problems. Trust me when I say vitamin B12 is linked to more than just energy levels and brain function. It can even affect the way you see the world. Most people never imagine that something as simple as a vitamin deficiency could cause vision problems. But a lack of B12 can do exactly that. Here's how it happens. Vitamin B12 is essential for maintaining the myelin sheath, the protective covering that surrounds and insulates your nerves, including the optic nerve, which connects your eyes to your brain. When your B12 levels drop too low for too long, this protective sheath begins to break down, leading to a condition known as optic neuropathy. As the optic nerve becomes damaged, the electrical signals that carry visual information from your eyes to your brain start getting interrupted. Over time, this can cause blurred vision, double vision, reduced color perception, or even blind spots in the visual field. In some cases, people notice that bright lights appear dimmer, or that their eyesight seems washed out, even though their eyes themselves feel perfectly fine. Muscle weakness and poor coordination. Let's be honest, when most people start to feel weaker than usual, they often assume it's because they're getting older, not exercising enough, or maybe just not eating enough protein. But here's the truth. Muscle weakness and poor coordination are actually some of the most overlooked warning signs of vitamin B12 deficiency. Remember earlier when we talked about how vitamin B12 plays a critical role in maintaining your nervous system? This is exactly where that connection becomes clear. B12 is responsible for forming and protecting the myelin sheath. That's the fatty coating that surrounds your nerves and allows messages to travel quickly and efficiently from your brain to your muscles. When your body runs low on B12, that protective sheath starts to break down. And once it does, the communication between your brain, spinal cord, and muscles begins to slow down and misfire. What happens next? You start to feel weaker, less coordinated, and sometimes even unsteady on your feet. It's not that your muscles are suddenly failing. It's that your nerves can't send the right signals anymore. You might notice that simple things like climbing stairs, carrying groceries, or standing up from a chair feel harder than before. Some people even experience frequent tripping or dropping objects without realizing that it's not just clumsiness, it's their nervous system struggling due to B12 depletion. Fast heartbeat or irregular pulse. Fast heartbeat or irregular pulse are symptoms most people immediately associate with magnesium, potassium, or iron deficiency, and rightly so, because these minerals play a key role in heart rhythm and muscle contraction. But what many don't realize is that vitamin B12 deficiency can also cause the heart to work overtime, sometimes in dangerous ways. When fewer healthy red blood cells are available due to low B12, less oxygen is being delivered to your organs and tissues. Your heart senses this shortage and begins to beat faster to compensate, trying desperately to pump what little oxygen-rich blood is available to meet your body's needs. Over time, this can lead to palpitations, irregular rhythms, and in severe cases, even an enlarged heart, or heart failure if left untreated. According to a study published in the Journal of the American College of Cardiology, People with long-term vitamin B12 deficiency often show increased heart rate and altered heart rhythm patterns, especially those with concurrent anemia. And here's the part that's even more concerning. Many people dealing with B12 deficiency-related heart symptoms never connect the dots. They might take magnesium or potassium supplements, thinking that's the fix, while the real problem, a lack of B12, continues silently in the background. You may start to feel short of breath after minimal activity, experience a pounding heart, or notice fluttering sensations in your chest. These are all warning signs that your heart is under unnecessary strain because it's trying to compensate for oxygen deficiency caused by low B12. Tingling or numbness in hands and feet. Now this is a big one, and it's often the earliest sign of nerve problems, which if not treated can eventually progress to full-blown nerve damage. Many people notice a pins and needles sensation in their hands or feet and dismiss it as fatigue, poor circulation, or just sitting awkwardly. But one of the most common hidden causes is vitamin B12 deficiency. Without enough B12, this insulation provided by myelin sheath begins to break down, causing nerve signals to misfire. The result is that tingling, numbness, burning, or electric shock sensations in the hands and feet start to appear. This symptom is linked to peripheral neuropathy, where damaged nerves fail to communicate properly with your brain and muscles. It's the same process that explains why some people with B12 deficiency also experience muscle weakness, poor coordination, or balance problems, which we've discussed earlier. Scientific studies have shown that B12 deficiency is one of the leading reversible causes of peripheral neuropathy, especially in older adults. If left untreated, this nerve damage can become permanent, which is why catching it early is critical. Constant fatigue and low energy. Many people think feeling tired all the time is just part of life, especially as we get older, but persistent fatigue and low energy can actually be one of the most telling signs of a vitamin B12 deficiency. It's not just being sleepy or needing coffee, this is a deeper systemic problem affecting your blood, nerves, and even your brain. Like we said before, vitamin B12 is essential for producing healthy red blood cells, which deliver oxygen to your muscles, organs, and brain. When your B12 levels are low, your body ends up with fewer and weaker red blood cells, meaning oxygen delivery is compromised. The result is a constant feeling of weakness, exhaustion, and mental fog, even if you're eating well and sleeping enough. But the fatigue doesn't stop at your muscles. B12 also plays a critical role in maintaining your nervous system. Low levels slow down nerve signaling, which can make your brain feel sluggish, worsen concentration, and amplify feelings of low energy. This is why fatigue often appears alongside other B12-related symptoms we've discussed, like tingling in the hands and feet, poor coordination, and brain fog. Now that we've covered the 9 early signs of vitamin B12 deficiency, it's time to talk about the most important part: how to recover and restore your B12 levels safely and effectively. Vitamin B12 deficiency can sneak up on anyone, especially people over 60, vegans and vegetarians, or those with digestive issues, and catching it early is crucial. The good news is that, in most cases, deficiency is reversible with the right approach. Recovery usually involves a combination of dietary changes, supplementation, and, in some cases, doctor-prescribed injections, depending on how severe your deficiency is and how well your body absorbs B12. First, let's talk about dietary sources. Vitamin B12 is naturally found in animal products like eggs, fish, meat, and dairy. For those who avoid animal products, fortified plant-based foods such as cereals, plant milks, and nutritional yeast can be helpful. While diet alone can work for mild deficiencies, absorption issues often make supplementation necessary, especially in older adults or people taking medications that reduce stomach acid. When it comes to supplementation, many people buy standard B12 tablets, usually in the form of cyanocobalamin, thinking it will solve the problem. While cyanocobalamin can work for some, there's a much more effective form that your body can use immediately: methylcobalamin. Here's why the methylated version of B12 matters. Vitamin B12 in its natural active form is methylcobalamin, which your body can use directly in critical processes like nerve repair, red blood cell production, and DNA synthesis. Remember that catching B12 deficiency early can prevent serious issues like nerve damage, cognitive decline, and heart problems. Always choose the methylated forms of B12 for the best results, and consult your healthcare provider before starting any new supplement. If you found this video helpful, hit the like button, subscribe, and share it with someone who might benefit. Thanks for watching, and see you in the next one.